Dr. Tatachi Egbu, and I am with the South Broward Alumni Chapter of Delta Sigma Theta Sorority Incorporated here in Broward County, Florida. We service the south end or the southern end of Broward County, and we are delighted to be here today on this World AIDS Day to have a candid conversation about the state of AIDS in Broward County, the state of Florida, and then what that means for beyond our borders. We are really delighted to have with us today some wonderful staff members from the Florida Department of Health, Broward County, and I'm actually going to let them introduce themselves to you. So go ahead.
Good evening. My name is Krystle Mobley. I'm the Minority AIDS Coordinator.
Good evening. My name is Evelyn Ullah. I'm the Director of the HIV/AIDS and Viral Hepatitis Program.
Good evening. My name is Janelle Taveras. I'm the Monitoring and Evaluation Consultant for the HIV program.
Hi, good evening. My name is Raina Mills, and I'm the Early Intervention Consultant here at the Florida Department of Health. I'm with the HIV/AIDS program as well.
Good evening. My name is Sherley Maturin. I'm a Health Educator Consultant with the Florida Department of Health in Broward County.
Good evening. My name is Elvira Calazer, and I am the Perinatal Coordinator.
And on the phone.
Okay, and then we have on the phone, on the other video, Yvette.
Hi, my name is Yvette Gonzalez, and I am the Perinatal Director and the Director for Linkage to Care for the Florida Department of Health in Broward County.
Fantastic. Thank you, ladies, so much for joining us. And we're going to go ahead and get started. This is a half-hour conversation, and we don't want to waste any time. Again, thank you so much for joining us and giving your time on this World AIDS Day. From what I understand, you all have been very busy today. You had about 4 events today?
Yes.
And you're not done yet. You still have more to do.
Exactly, yes.
Well, work is never done, and we thank you for taking time out of your busy day. So if you could, just give us a brief overview. Even though we think that people already know what HIV is and what AIDS is, do you think you can just give us a brief overview of what HIV AIDS is specifically?
Shall we?
Sure.
Yeah, anybody can do it. It's
okay. Overview of HIV.
We want to do this thing.
Okay. HIV stands for Human Immunodeficiency Virus. It's the virus that causes AIDS, which stands for Acquired Immunodeficiency Syndrome.
35 years ago, the first case of HIV garnered the world's attention, and since then, over 575,000 Americans have lost their lives to AIDS, and more than 56,000 people in the United States become infected with HIV every year.
Wow, wow. And you know what I did remember, was there was something that you wanted to say. You had kind of an overview statement?
Yes, well, this is World AIDS Day. So on this World AIDS Day, people across the world are coming together to stand in solidarity with people living with HIV and commemorate those who have died of HIV-related illnesses. Since 1988, the inaugural World AIDS Day year, no one on the front lines could have conceptualized taking just 1 to 2 pills a day for HIV treatment, or that a pill can prevent HIV. Today we know that as PrEP or Truvada. Or that if a person living with HIV is diagnosed early enough today in 2015 and begins treatment right away, they could have an average life expectancy of 75 years. However, today in Broward County, we need to question our knowledge, attitudes, and beliefs about HIV/AIDS and challenge our comfort zone. We must ask ourselves, what is really driving and fueling this epidemic in our community? If we really believe Black Lives Matter, then we need to commit to stop fueling systems of oppression. Sadly, rampant stigma, ignorance, fear, and other social determinants of health continue to fuel our local epidemic. We all have a personal role to play in being that voice for change, and we all believe in the vision of the National HIV/AIDS Strategy, which President Obama put into effect in July of 2010, which actually Broward has adopted that vision, and that vision is that the United States, or Broward County, will become a place where new HIV infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care free from stigma and discrimination. So we all have a personal role to play in being that voice for change.
Wow, thank you. Thank you for that. Great. So now we've set the stage with the statement. We've talked a little bit about what HIV/AIDS is. And so what are you seeing in terms of, again, we're talking about the 1980s when we first started to see cases of HIV/AIDS crop up. What are you seeing in terms of how people are acquiring it now compared to what it was then? Are you seeing trends? Or are you seeing differences?
Mm-hmm. Yeah, so initially in the epidemic, people thought that HIV was a gay white man's disease. And now we know that that's not the case. We still see a lot of men becoming infected through having sex with other men, but we see a lot of heterosexual acquisition, especially in our minority populations, such as our Black communities and our Latinos.
Okay, so what are the differences in terms of stigma that you're seeing between then, in the 1980s, up till now, 2015? So we know what the facts are, but what about the stigma? Does that still exist the way it did in the 80s?
Stigma still exists, and it's very deep-rooted, and it may not manifest itself in the same way as it did early on in the epidemic, but it's definitely a barrier for individuals to get tested, to get into care, and to get in treatment. And actually, you know, we don't quite know how stigma is manifesting itself in Broward County. And right now we're trying to uncover that. We're trying to understand community perceptions about HIV, why they don't get tested, what they think about when we talk about HIV. And it's really impressive to hear the misconceptions and misunderstanding around HIV and risk behaviors and who's at risk. And so there's a lot of education that still needs to be conducted in our communities.
And that's part of what you all do at the Department of Health, Broward County, correct?
Yes, definitely, yes.
Fantastic, fantastic. Let me, because Yvette is just hanging out, I'm going to come back to you all, but I want to turn the attention to Yvette so she's just not hanging out there in cyberspace. And I'd like to say thank you to all of you that are watching through YouTube. Thank you to all of you that are watching through Periscope. We have 2 Periscopes going, the South Broward Alumni Chapter and my personal Periscope, and YouTube. So all of you out there in Cyberland, thank you for joining us. So Yvette, tell us a little bit about your role and what you want to bring forth to the conversation.
So I've been working with HIV and with pregnant women since 1988. And at the beginning of this epidemic, I was very, very upset because women weren't in care, children were dying. And now things have changed so much with medication, with triple therapy during pregnancy, especially having AZT. During the pregnancy, we see that a woman can possibly have zero transmission. It's almost 1% chance of having a baby that's with HIV. My job is really to case manage a lot of these pregnant women that are positive in our county. We have over 100, sometimes 127 a year that we follow. And we follow them because we want to make sure that they're in care, that they see their infectious disease doc, that they see their OBGYNs, that they're on medication, that these babies are tested, they're exposed to the HIV, but by taking medication and doing the right thing, these babies are negative.
Wow, that's amazing. And you mentioned AZT. That's something, you know, the conversation is not focused on HIV/AIDS like it used to be in the media. In fact, there's that a lot of people still think that it's not a major problem because we don't hear it in the media often. And so the last time I heard AZT was a while ago. So is that still a drug that's being used to treat?
It's absolutely a drug that's used during labor and delivery. They're doing during the labor process to make sure that if they're having a vaginal delivery versus a C-section, that there isn't transmission during that time. And then the babies are given AZT for 6 weeks, and it's all preventive. So it's still definitely being used during the maternal process.
Okay, fantastic, fantastic. So I kind of want, since we're on this track, I'd like to turn the conversation to new drugs. What are some of the new drugs, and whoever can answer this, that are on the horizon in terms of treating HIV?
Did you want me to speak on that?
Whoever would like to speak about that. I know that that was something that we talked about that we would like to cover. So what are the new drugs that are out there?
So what's happened now is that they have combination drugs. They have drugs that have 2 drugs in them, 3, 4 drugs in them. Just the other day, the FDA introduced a drug which had 4 types of medications within one pill that you can take once a day. And that is fabulous, because that means that those drugs can hit the different parts of the system where it could really control the HIV virus, where you have undetectable viral loads. The only thing that is during pregnancy, they do add the AZT. That's the only thing.
Okay, okay. And you mentioned, someone mentioned PrEP. Can you talk more about what that is? Because I don't think a lot of people are familiar with exactly what that is.
Okay. Yes, PrEP is post-exposure prophylaxis, and what it is a single daily pill that can reduce of acquiring HIV through sex by more than 90%. And relating it to African American women, they really don't know much about pre-exposure prophylaxis, which is the medication Truvada. And when it's taken by people who do not have HIV, it reduces their risk of acquiring the virus.
Yeah, right now the national conversation is about PrEP and men having sex with men, because most of the studies have been focused on men. But PrEP is for women. We haven't had that conversation. And so we really need to begin to spread the word about this prevention tool. It's a very critical tool, and it can abate new infections greatly in the United States.
Wow, wow, that's amazing. Now I want to look at numbers in terms of HIV infections for women of color in Broward County. Do you have numbers in terms of how many women of color are affected, or infected, I should say, with HIV in Broward County? And then maybe you have some statistics that kind of point to the rest of the country as well.
Okay, so I'll start in, and then Janelle will jump in as well. So in South Florida, Black women are disproportionately affected by HIV in comparison to Hispanic and white women. In Florida, there's 1 in 61 Black women were living with HIV in 2013. And when you compare that to 1 in 1,092 white women and 1 in 466 Hispanic women. So, you know, the numbers alone just show you the huge disparity between Black women and Hispanic and white women.
So last year in 2014, we had a little bit under 1,000 cases, 993. And then of those cases, and these are new cases of HIV, we get about 1,000 annually average. 42% are among Blacks, 38% among whites, and 18% among Hispanics. And when we talk about the age range of women getting infected, we're seeing more cases in age 50 and over, and also in 30 to 39, then followed by 20 and 29. So this is definitely not just a young person's disease either. We're seeing a lot more transmission among minority women that are 40 to 49 and 50 and over. And 40% of our people living with HIV and AIDS in Broward County are 50 and over. 40%.
50 and over. So I want to ask 2 things. Why the disparity when it comes to women of color, and then, or people of color and women of color, and then why over 50? So before I ask you that, or I let you answer that, I want to, for those of you that are members of the South Broward Alumni Chapter that are watching on YouTube, I have a code word for you that I want you to use, and that code word is ribbon, in honor of World AIDS Day. So the code word is ribbon. So sorry, I just had to take that point of personal privilege for our members. And so go ahead. What's with the disparity in terms of people of color, and then in terms of the age?
You know, there's a lot of social determinants of health when it comes to the disparity, and among with various social, psychosocial, and structural barriers. All of that are all contributing factors. When you think about it, especially with women, you know, our focus are not always on our health. We're concerned about running the household, taking the kids to their activities, being a wife, and everything else that comes along with being a woman. So a lot of times, health is not the priority.
I'd like to jump in for a minute because definitely I agree with Krystle. The pregnant women that I case manage, about 87% of them are Black, and next would be Hispanics. And exactly what she just said, these women do not take care of themselves. But when they're pregnant, they at least think about the baby and they do go and seek care. But once the babies are born, they stop taking meds. And it's terrible because they could live for a very long time if they're on medication.
Now, why do they stop taking the meds?
There's all different reasons. Reasons that they don't have time. You know, now they have another child. They're undetectable sometimes during their pregnancy. So maybe they feel that, you know, they can be undetectable for a while until they start taking meds again. There's all different reasons, you know, time to get to the physician, you know. So there's not one thing that we can pinpoint. All I can tell you is that they do need a lot of help, and that this is what we do. We try to bring them back into care.
You know, most people don't adhere to drugs. I mean, how many people really complete their full cycle of antibiotics when we're ill? You know, when you start feeling better, you stop taking your meds. You know, or for many people in our community, it's the stigma again. You know, you don't want to have your medications out in your medicine cabinet. You don't want people looking in there or knowing that, you know, you're infected. So, you know, that's one of the reasons. Krystle mentioned social determinants of health, and, you know, we really need to go back to what are those social determinants of health. It's going back to unemployment. It's housing. You know, we have sex workers. It's survival sex. You know, this is a way that, you know, some of our population is making a living. So these are things that we all need to consider, you know, when working and educating our community. And we have to start talking about sex. You know, it's such a big secret in so many places, and it's taboo. One of our staff here, Elvira, works with the faith community and volunteers with the faith community. And Elvira, you can chime in and talk about this.
Yeah, absolutely. That would be great.
Yes, we have seen over the years that there has been some changes within the faith community, that the ministers or the churches are trying to get involved, but we still are in the fight of trying to get others to join in. And one of the biggest thing is stigma, because they feel that if someone is aware of their status within the church, they will be, you know, in other words, denied of doing certain things, taking part within the church, to help within the church. So therefore, you know, the stigma still exists. And, you know, and that's one of the biggest things that we do face within the, you know, faith community.
So how do you work with churches and other houses of faith to try and deal with that stigma and try to have them have services there? What do you do to work with that community?
One important thing is education, because we still have a lot of people that do not understand what HIV means. They still think about having HIV means that death, that they will be dying. You know, after a certain few months that they are aware of, you know, their status, they will die. So education plays one of the, you know, biggest role that we need to educate, you know, others, and ministers including, because some ministers still having a difficult time, you know, having the reality of this is in existence. This is something that we are facing at our home, church, everywhere that we go, and is within the church. we still have ministers that are saying that, no, I don't have any members that have that, quote unquote, that they will, stress that way. That's saying that, well, our people, or our church members, our constituents, they do not have it. So we still need to educate, teach them, and for them to be informed. And that's one of the biggest, issue that we face and we try to do, is to educate them. And to also know that it's important to know your status. It's important to get tested. It's important to know that when you do get tested, that there are services that are available. There are, medications that are available, and that their lives can be prolonged, instead of thinking that, well, I will dead, be dead by tomorrow.
Mm-hmm. Are you finding that there are some ministers still on the church and religious thing? Are you finding that there are some ministers that are very accepting and wanting to inform their members?
Yes. Yes, and that is, one of the things that we have seen over the years that have changed, but still it remains, something that is being swept under the rug, that we don't want to face it. We don't want it to be part of our church, which, it is, but we still have ministers that, do not want to talk about it. And so those are the ones that are, difficult, to reach, but, we cannot give up.
And then for the ones to jump on what Ms. Elvira just said, for the leaders that are open to discussing HIV and receiving the education that we have an initiative in the state of Florida called Faith Response to AIDS. And with that, what we do is we mobilize and engage faith-based institutions to join us. So we go to them, they sign up under this program, and we'll take different services to them. It may be that we'll provide information so that they can have an HIV sermon one day of the year, or they'll allow us to bring our testing van and test on a Sunday, and we can provide outreach and education to their congregation members. So we do have faith leaders that are open in Broward County to learning more and to bringing our program and bringing this information to their members of the church, because we all know that faith, especially with the Black community, faith is very important. And, we need our leaders, our faith-based institution leaders, to join us and to get this information out to their members.
Fantastic, fantastic. So I want to go over, anyone can go over this, risk factors. I think we all think we know what they are, but I think sometimes we forget. What are the risk factors for people in terms of contracting HIV? And yeah, the risk factors.
Okay.
I can speak for my women, and then...
Yeah, absolutely. Go ahead.
Okay, so the women that I follow, the risk factors are heterosexual. And then I have that 10% that are perinatally infected. So these are women that were born with the virus, and, now they're pregnant because now they're in their 20s. So it's heterosexual, most of it, and then the perinatally infected women that are growing up and having babies.
And it's also heterosexual contact, having vaginal sex, oral sex, anal sex as well, substance abuse, injection drug users, and it can be so many things.
So basically, anybody is at risk if you're not taking the proper
precautions. Anyone who is sexually active is at risk. Or using drugs is at risk.
Yes.
And I think that's a mistake many of us make. We think we feel, we're safe, and we're not asking about sexual history.
Can I speak about that too?
Sure.
Yeah.
And
so I think, we talk about heterosexual sex, being a big risk factor among women. I think a lot of women have a misconception of risk, and they don't understand the risk that they're at through their partners, because maybe they have one partner, but their partner does not have one partner, and they don't have those discussions with their partner about their sexual history. And I think the people who are at risk are those who are not talking about it, who are not having conversations with their partners, and who don't understand that they're at risk. And so it's about speaking up It's about having meaningful conversations with your friends, with your family members about HIV, and understanding that we're all vulnerable. We can control our own behaviors. We can't control our partner's behaviors. And sometimes we really don't know who we're with. And so it's important for us to get tested, to put ourselves and our health first, and to have as much of those candid conversations and just normalize the topics of HIV and AIDS and getting tested, so it's just a normal thing.
Yeah. And so women who are uncomfortable negotiating safe sex practices can look at, you know, the new therapy of taking Truvada, of using PrEP. That can help women protect themselves. So that is new, but again, as you know, my colleagues have been discussing, you know, we're not having these conversations in the community because some women are fearful. They're fearful of partner violence, and so we're going to have to engage them in different ways in terms of how to protect themselves. And this is something that we really haven't done in the past.
Yes, and I actually wanted just to add some information based on what my colleague Janelle mentioned about, you know, those who are in relationships and engaging in condomless sex. You know, the importance of getting tested and having those conversations with your partner. The recommendation is to get tested every 6 months. And so here in Broward, one of the initiatives that we've adapted from CDC is to have the couples HIV counseling and testing services. And there are agencies here that provide that, where a couple, depending on what your relationship is looking like, that could be a varied amount of things, can go in together and have their tests conducted and then results read and be able to kind of negotiate the rest of the relationship based on those results.
Wow. So are you finding that women of color are more reluctant to talk about this with their partners or their children or whoever than other women, maybe, than, for example, white women? Do you find them more reluctant?
Well, I think based on the information that Krystle shared previously about, you know, black women really taking care of others prior to taking care of themselves, those things kind of take a back seat to having those conversations, because if you're worried about bills getting paid, or if you're worried about being able to put clothing on your children and care for your family, it may be not in the forefront of your brain in order to have those conversations, because maybe they're just not as important of the list of tasks that you have to address that day.
So I think I'd like to know, because we have about a minute left, I'd like to wrap up with this in terms of what's next, what's on the horizon in terms of HIV/AIDS education, in terms of research, if you're aware of that, in terms of the direction that the Department of Health, Florida Department of Health, Broward County is going with this. What can we expect to see from you all next?
Absolutely. Before I introduce Krystle, I just wanted to, you know, let everyone know that we're moving into fourth-generation rapid testing. So there's a test out there that can be conducted within 20 to 30 minutes that will yield a result on whether or not you're HIV antibody reactive or HIV antigen reactive. And so that fourth-generation testing is really getting new infections sooner than they have before with third-generation testing.
Fantastic. Good. All right. So, final thoughts in terms of this topic. Anything that you wanted to add?
Yes, definitely. Tonight we want to just bring home that anyone who is sexually active, whether that's vaginal, anal, or oral sex, that you get tested. And if you have higher risk factors, then you should be getting a test every 3 months. If not, then at least every 6 months. There's free testing all over Broward County. So if you visit browardgreaterthan.org and you go to that website, you can put in your zip code. It'll tell you in your area where all the free condoms and free testing sites are located in that area. Through our business response to AIDS, we have engaged 899 businesses surrounding Broward County. So no matter where you are in Broward County, you have free condoms and a free testing site located near you. So that's something definitely that we want to drive home, letting everyone know that if you go to that website, you can definitely find a list of resources available to you.
Fantastic. That's great. Can you give us that website again for people who are interested in the information?
BrowardGreaterThan.org.
BrowardGreaterThan.org.
Also, if we can, just give you a number. So if you have any problems with maneuvering the website, you can give our office a call. And that number is 954-467-4700. And our department extension is 4991.
Fantastic. So what we'll be sure to do is to get all of that information up on our website for those people who have questions so that they can contact you, and we'll put that up on our social media as a post-wrap. Anything else that anyone wanted to add about this topic?
Mm-hmm.
No, thank you for that.
Yeah. Well, no, you all were very comprehensive, and we thank you all so very much for being here today. Let me thank you all again, the staff members, the various staff members from the Florida Department of Health, Broward County, from the HIV/AIDS viral and hepatitis program. Is that correct?
Correct, yes.
Okay, it's a mouthful, but thank you all so much for being here. Also, I'd like to say that this, again, was an effort by the South Broward Alumni Chapter of Delta Sigma Theta Sorority Incorporated. We serve the southern end of Broward County, and we wanted to bring this to you in honor of and recognition of World AIDS Day. This was actually the International Awareness and Involvement Committee that put this together with some help from the Information and Technology Committee. So kudos to both committees for putting this on. I'd like to thank once again our honored guests, our panelists, and then all of you out there on YouTube and Periscope for joining us in this conversation in recognition of something that still affects us, that has not gone away, but hopefully with education will be more under control. So with that, I sign off. I say thank you all for joining us, and feel free, if you have any questions, to contact us at our website. Our website is www.dstsouthbroward.org. Again, www.dstsouthbroward.org. From there, you can follow us on our social media. We've got Facebook, Twitter, Instagram, Tumblr, and Periscope, of course. And you can tweet us, do whatever you like, contact us that way if you have questions about anything that you heard today. We can pass on the questions to them.
So leaving, can we put a last plug in that we forgot to mention? It'll take a half a second. We just wanted to mention that we have community ambassadors through our Sisters Organizing to Survive, and this is an initiative that was created in 2008 by the Florida Department of Health. And with that, we have community ambassadors that go out as gatekeepers and just educate other women in their communities and in their church regarding to HIV and AIDS. So when you visit that website, there's an option to become an ambassador. Just click on that SOS, and we'll love to have you. Thank you.
Fantastic. And again, I want to thank all of you for being here, and all of you out there for being here. Have a good evening, and look for some more Google Hangouts from us very soon. Take care, all, and thank you, ladies.
Bye-bye.
Thank you.
Bye-bye. Thank you.
Bye.